Well, welcome everyone. And at this point, I'd like to call to pass the mic to Dr. Brophy, the chairperson of the Board of Health.
Okay, so I'd like to officially call the meeting of the Board of Health for May 6th to order. First item on the agenda is the approval of the minutes from the April board meeting. Mr. Fisk, and any changes or recommendations to approve the minutes from the previous meeting?
No, they seem fine. I vote to approve them.
Okay, we're all in favor. The minutes
Aye.
passed. So with us today are 5 members from BAMC and the Brockton Community Board of Health, Brockton Health Center, that are here regarding modifications to the memorandum of understanding that exists between BAMC and the Board of Health for the City of Brockton. These are in regard to providing authorization for them to station a mobile unit at various locations within the City of Brockton, and a second regarding some removal of restrictions in their needle exchange programs. So if the members from the Brockton Neighborhood Health Center could just quickly introduce themselves to Mr. Fisk.
Sure. Yep. So my name is Allison Pinkover. I'm the program manager of substance use services at Brockton Neighborhood Health Center. So we're the entity that's overseeing the mobile program in question, and then BAMC is here specifically in regards to the syringe services MOU. So I'll let BAMC introduce themselves.
Hello, my name is Jesse Pack. I'm the director of HIV services at BAMC. I oversee the COPE Center, where we operate a syringe access program. We are funded through the State Department of Public Health, and that requires us to have an MOU with the Board of Health for our operations. The problem we're having is that the current MOU limits us to the location of 74 Pleasant Street, and we would like to offer syringe access services on the neighborhood healthcare mobile van that is going to have several stops throughout the city. And we would also like to remove the restriction of the one-to-one restriction on our operations. Currently, just to put it in context, so number one, we're limited to 1-for-1 exchange only. So someone has to bring the exact same number of needles in to get what they're asking for. We are currently the only needle exchange program in Massachusetts that operates in this way, of over 30 programs throughout the Commonwealth. All those other programs, the way they operate is people come, they always bring back stuff, but they're not limited to 1-to-1. They're able to get the exact number of syringes that they need, which is particularly important for homeless individuals or people who are prone to having their property stolen or confiscated, which happens quite a bit if folks are living outside, which makes it more difficult for us to get the supplies that those very high-risk people need.
Okay.
Teresa, did you want to say anything?
Yeah, so I'm Teresa from BAMC as well. I oversee the adult behavioral health services. Yeah, so Jesse did a great job. And we, not a lot of times, we take in a lot more needles than we actually give out. Because again, people will come with a whole pack, but and we also, go out and do outreach and pick up needles in the neighborhood, that type of thing. But I don't remember, Jesse might know how long we've been restricted to the one-on-one. So, I mean, to me, It is two separate things. It seems like the issue with the address and the mobile van is more, not emergent, but it's something that you're gonna need to know about pretty soon, because so BMZ is obviously providing staff and we're coordinating with the health center on the craft van, and you might want to talk a little bit about that, Allison. And to do the syringe exchange. And so that's kind of in my, that's kind of one decision. The second decision about opening up the one-to-one exchange is something else, but we would like that as well. But I mean, one is more immediate than the other.
If I could just elaborate a little bit more, Dr. Brophy and Mr. Fisk.
Yep.
I found out that there was an existing MOA which was signed by Amy Badger in 2019 under Mayor Carpenter. So that includes the 1-in-1 syringe. And then
Okay.
the location was just one location. So I understand that there are some restrictions as to certain areas that the mobile van can station. So those are the two main issues. A memorandum of understanding or agreement that would allow the mobile van to be stationed at certain locations, and then to switch from 1-to-1 syringe to a different modality.
Yeah, so one of the things I would just want to clarify, and I am happy to give as much detail as anybody would like about the mobile services as well. I'm happy to give an overview, answer questions. But the majority of the locations are private locations that we do have permission to park in and deliver services in. There are two locations which are owned by the city, one that is under the authority of the parking board. And so like permission for those locations we've been speaking to the city about. I know that when we spoke with the mayor, he wanted to make sure that, we let the Board of Health know we were looking at those locations. But the majority of locations where we will be offering services don't require an MOA with the Board of Health. And we do have permission from those private businesses to operate there.
And how many locations is that within the city that so you're currently operating in certain locations with other services, is that correct, or?
Not quite yet. So the very last piece of kicking off the mobile services, we're waiting on approval of our DPH application. So that went in about a month ago. Yeah, we expect to hear back on that very shortly. So as soon as we have that approval, we plan on starting services.
Wasn't there a mobile unit always in Brockton? I remember when it was down by the police station. There was a mobile unit at one time.
I don't know. So I've worked for the health center for about 5 years now. And so I am fairly familiar with the healthcare landscape, though certainly not an expert. And so, I mean, the health center originated from a mobile unit, from a van. So we've actually said this is kind of like us going back to our roots in a lot of ways, which is how we started. But there is definitely no mobile addictions program south of Boston at this point. This is the first one.
Well, I certainly support you, especially from a father that lost his son to a drug overdose. I certainly support all of you and anything that you can do to help out the city in this regard, having gone through this whole thing myself.
Thank you. We're eager to start providing services for sure.
And so, and what other services besides the needle exchange do you guys actually plan on doing through the mobile health service?
Absolutely. So I sent a PDF of some slides over to Dr. Mondesir earlier this week that you all should have access to. But I can also screen share if that's easier for everyone. I don't know what your preference might be.
I don't think either of us got in on screen, so.
Okay, so let me just get them up so that I can read off to you so that I don't lose my and I should hopefully answer all those questions. So there's actually a lot of things that we will be doing out there. And so the primary goal is to really increase access to medications for opioid use disorder. So Suboxone and Vivitrol, we would not be providing methadone because the regulations on that are extremely difficult. So we would be providing Suboxone and Vivitrol. We have the ability to distribute naloxone and do overdose prevention training. We are able to do a lot of medical services like wound care. We'll have the ability to do blood draws. So we'll be able to do hepatitis testing, HIV testing, other labs. We will be able to do PrEP and PEP for HIV. Some immunizations. We will be offering the one-shot Johnson & Johnson COVID-19 vaccine out there, and really offering like case management, referral to other services, with linkage back to brick and mortar Brockton neighborhood, as much as possible as well. Making sure people have things like clean syringes, clean works, condoms, things like that. So it's pretty comprehensive in terms of medical care. And then I also can let you know about the locations if that's helpful as well.
Yeah, that'd be great.
Great.
Sounds good.
Yeah, so we will be operating 4 days a week. There's a morning session and an afternoon session. So Mondays, we will be at Universal Missionary Church by Perkins Park. And in the afternoon, we will be up at Westgate Lanes. There's a lot at 69 North Montello Street. We'll be at Tuesday morning. And then the city has given us permission to use the Howard School at 837 North Main, Tuesday afternoons. Thursday mornings, we will be at the Roadway Inn. We have permission from Father Bills in Mainspring to use that space. We've been speaking with BAMSI. We were looking for a spot up at Westgate, and they do have a new landlord at 375 Westgate Drive. So we are trying to finalize a time Thursday afternoon there. Friday morning, we will be in the parking lot at Signature Hospital. And in the afternoon, we are looking to use the parking authority lot at 285 Montello Street.
Okay.
What
So
type of
fairly-
advertisement are you going to be using so people know that these places are available and where you are? So that, people that probably would have a hard time knowing what's going on would know about this type of service.
Yeah, that's a great question. So we have a whole bunch of print materials ready to go that include like the schedule and locations for people. But the model of care, so there'll be a nurse practitioner on this unit at all times with a licensed practical nurse who's doing the blood draws, as well as some other medical services. And then 2 other people who are either a recovery coach, a street outreach worker, somebody from Cope Center, who are out and about kind of connecting with people who may be staying outdoors, saying, hey, we're over here today, come see us. There's also some advertisements on the BAT buses right now, so those are actually out. But we have a bunch of print brochures that we're happy to distribute to different healthcare providers or other organizations in the city. But the real model, it's serving people who traditionally struggle with medical care. And so really the street outreach is going to be the biggest thing for bringing people in for care.
I see.
Great. Great. Yeah. And fairly ambitious. It sounds like you've got multiple areas of the city covered in doing this as well. So that's good. So, yeah.
Yeah, we actually, the only thing I'll add with the locations. So one of the first things that we had done, because we wanted to try to make those locations based off of some data. So the police department was kind enough to work with us to give us some information on like overdose hotspots in the city. They had mapped those out for us. Frequent sites of narcotics violations and syringe pickup. So these are places where people are already hanging out. It's nothing new. So each of those locations too were based off of some data that we were able to look at as well.
Right, and do you expect any challenges in those locations as you go into the community? Because these are all new sites for you, correct?
They are, yep, absolutely. The feedback we've gotten from the Boston Healthcare for the Homeless program, which is the community health center who runs the mobile services in Boston, is that it's really kind of a slow growing service. It takes a little while to really build the trust of people that you're looking to serve, and then, you know, also continue to work with the community if there are concerns that come up as we're out there. Any of the sites that we've been in touch with so far have my personal cell phone number, have our project manager's personal cell phone number. And so, you know, we want to make sure we're reaching people and serving people, and also, you know, being mindful of the feedback we're getting from the community as well.
Great, wonderful.
Good.
So I just had, you know, it's an amazing effort that you guys are putting forward to get out there into the community, because certainly, you know, in the city, you know, it's boots on ground, and being where the need is important within the city. So this is wonderful. I think when Jesse was presenting, you were saying in the needle exchange that, you know, it has been a one-to-one, but Jesse, I think you mentioned it as being the exact number of syringes is needed. And that's sort of, I'm trying to in my head say, well, how do you determine what the need is for any individual? And
Are you asking me how we determine the
yeah,
amount?
you say you give the exact number needed for the individual. Is it based on, you know, how do you determine the need in the needle exchange? Just give me an idea. It's just an idea of what the needle exchange involves.
So currently, people have to bring us the exact number of needles used to get the exact number that they want. The way we would like to operate is we take back what people bring us, but we give them the amount that they need. And that's typically like a 10-pack. Some people who only come in maybe once a week might need like a box of 100. Some people will exchange many, many needles at a time. We have one gentleman who exchanges over 500 needles at a time, and we count out what he brings back. So
The need is how often they come to see you in between? Is that?
yes. Some folks are able to come to us every day. Those are typically folks who are living outside in the area or who live in the area. Other people are only able to get to us maybe once a week. But people are injecting, particularly with illicit fentanyl, they're needing to inject every 2 to 4 hours. So we want them to always have clean syringes when they're injecting.
Got it. So the demand could be as much as 12 needles a day for some folks.
Yes.
Yeah.
Right. And so right now, if literally they walk in the door with 5 needles and they want 10, they can only get 5 back.
Got it. So then they have to come several days during the week to manage their addiction. Okay, great. Thank you. Just wanted to have an understanding of how you guys, how you manage the situation. So I think those were all the questions that I had. Mr. Fisk, did you have any issues?
No, I think she answered most of them. It looks like it's a big project, and it's certainly needed.
Certainly is.
I don't know about the needle type of thing, but I know they certainly need the people out there helping the folks that are on the streets. And it sounds like they're getting the word out.
Yeah, it certainly sounds like we're the exception to the rule for the state. Is that correct with the requirements of the one-to-one exchange?
We're the only one.
We're the only one. Oh.
Out of over 30 programs.
Okay, all right. And will we be we are the only program on the South Shore, or?
No, there's, well, yes, on the South Shore. No, there's one in Taunton. Seven Hills operates one in Taunton.
Okay, all right. So, and then is it, how far north before you hit is any of the other cities north of us? I'm just.
Not until you get to Boston, I don't believe. I think Quincy has a syringe exchange, actually. Okay,
wow. So these are really spaced out across the region. Okay. So I guess Dr. Montefiore, so I guess we have to make a motion to approve the changes, or will there just the additions to the MOU that's currently in place? No, excuse me, that's currently in place?
Well, there are three pieces in this case. There would be the current MOA exists between BMZ and BOH.
Okay,
So the issue would be drafting
so we have
an
to
MOU
amend, go ahead.
an MOA that would include three partners, Brockton neighborhood with BMZ and BOH. And then, so that would be the one change in the current or the existing MOA. Then the number of needle exchanges, and then the allocations.
Okay, and one MOA with all three parties is, okay, we don't have to have separate ones with BAMZ and with the community health clinic?
So we had discussed this a little bit at the health center. So the state law around syringe access requires that any OEND funded program through the Department of Public Health has an MOA with the city. So BAMZ is the OEND funded program. Our services, when we provide syringes, would be privately funded. So we don't technically need to pursue an MOA with the city, but we definitely would be agreeable to co-signing on BAMZ's MOA, given that they're providing services with us on the trailer.
But from the city part, what the Board of Health has to do, the Board of Health has to give the permission to BAMZ to be involved in the mobile health and to allow for more than a one-to-one exchange. Is that correct?
Correct.
Correct. Okay. And then and us giving that approval helps the city then move forward with making the arrangements for the MOA between the three parties. Is that correct?
Okay.
Okay.
So this is Teresa at BMZ. I just want to make sure I understand what you need from us. So a new MOA was developed. So you would like us to add Neighborhood Health Center on that? Is that what I'm hearing?
Well, it would be, I mean, since they're going to be involved in it, so officially that would be an MOA that includes Brockton neighborhood, BMZ as the lead partner, and then Brockton neighborhood, and then the city, the Board of Health.
Okay, and then go ahead.
Ms. Mary, I think what we're trying to clarify is the city can go into the memorandum of agreement with the parties, but for it to move forward, it sounds like the Board of Health has to give permission to BAMZ to expand their services and to allow for that change in the one-to-one needle exchange. And once we give that, then the city can work out whatever agreements in the memorandum of agreement between the parties. But we have to vote to allow BAMZ to be able to, because the neighborhood health clinic does not need our approval to do their mobile services. Is that correct?
Right, that's what I heard Allison say. This is Teresa.
Yeah.
Yeah. So
yeah.
then I guess the only other thing I don't know, and I'm asking Jesse's help with this, is it sounds like besides how the MOA is written right now, there's a separate document that talks about the one-on-one exchange. So should we put it all together, or should we amend that separate document?
Well, actually, the existing one, 2019, it has it allows the practice or the exercise of substance abuse program, as well as the sort of one-to-one. So, I mean, it does exist as one presently.
So it is one presently.
Correct.
Okay. All right. So, I guess the motion before.
In other words, it's one MOA with two separate clauses. Permission to do the substance abuse program, and then the syringe exchange.
Okay. So that would mean the motion for the board is that the board will allow for BAMSI, to change the memorandum, the agreement between the city and BAMSI to allow them to expand their services beyond their current Pleasant Street address to the locations where the mobile band will be located, and that we will allow for the needle exchange no longer to be one-to-one, but to be one limited, will be exchanged as to the supply as needed. Is that correct? Is that the terminology that you use?
Yes.
In the needle exchange? Okay, all right.
I have one question about as far as the exchange of needles. Just for anybody that's watching, I just want to wrap my head around this a little bit more. I could see one-to-one. Now, if we're giving somebody extra needles, just does this mean that he's going to be doing drugs more? Or we just want to make sure that he has clean needles, or he's helping out other people? I just want to wrap myself around this, because nobody else is giving more needles. It's a one-to-one, and now we're going to be giving more needles out. I just want you to explain that a little bit more to me, and maybe some other people that might be listening, that we're not, having people do more, drugs. You know what I'm saying? Just for somebody who might be listening.
Sure. So, I mean, syringe programs have been in existence and studied since the 1980s when the AIDS crisis happened.
Mhm.
And we now know, based on like decades of research, we know that the presence of needle exchanges and the giving of as many needles as someone is requesting does not end in more drug use on the part of the participant in the needle exchange program. The real risk that we're trying to avoid, particularly with the way people are using powdered fentanyl, people who are addicted to fentanyl need to inject every 2 to 4 hours. And we don't want them to ever have to use a dirty needle or share a needle to inject. We can point to the recent case that happened in Lowell a few years ago. Lowell had an HIV, a very serious HIV outbreak. Unlike Brockton, they did not have a needle exchange program at the time, like at all. And very quickly, HIV spread through the injection of fentanyl because, again, unlike heroin, when you inject every 4 to 6 hours, fentanyl you have to inject much more often, much more frequently, which increases every time you're injecting, you're increasing your risk of infectious disease. So really what we are trying to minimize is the spread of disease, and to make sure that people have the clean supplies so that every time they're injecting while they are using, they're doing it as safely as possible. And always our goal is to try and get folks into treatment. We work with folks where they are, and people usually come around to treatment, but it takes time. It can take a long time for some people, and while they're not ready, we don't want them to get sick.
I understand that. So basically, the bottom line is, if somebody's going to inject themselves, no matter how much they do drugs, they're going to do whether it's a dirty needle or not. So what we're trying to do is use a new clean needle to probably save their life and help out the whole situation with anybody that might be in there, a companion of them. I understand now.
I would reiterate too what Jesse mentioned earlier, in that most syringe service programs take in far more syringes than they distribute. And like we at the health center, we currently don't distribute syringes, and so we're glad that we're able to, because it's a significant public health concern. But we're out there picking them up too. So for as many that go out, a lot are getting collected, and so I think that's an important point that we would want to make too.
Thank you.
You know, that is an important point because you are taking dirty needles off the, hopefully not left in places that the exchange will bring them back to a safe place to be disposed of appropriately. And, you know, people are injecting as much as 12 times a day. You know, you're talking a 30-day supply that's, you know, that's approaching, it's like 360 or something like that, off the top of my head, of needles that they need just to come for even just once a month to the area for supplies. So, so it's not. I'm sure the number that come with the large number of needles is less, and being services and having access to the services is appropriate because obviously some of the difficulties is the difficulty in getting buprenorphine and getting the restrictions put on people that are on methadone, of getting to methadone clinics often is as much of a hardship in treating substance abuse disorders appropriately. So the easier we can make it for folks, the better. So
I agree.
So the motion is on the, I made the motion to allow for the expansion, the mobile expansion of sites where these services can be put in place, and that the needle exchange program could be given for a needle exchange as needed, as determined by the healthcare providers in the services. So,
I second.
all in favor?
Aye.
Right. So the city can move forward with making the arrangements with the MOU. Funny, in my work, it's called an I keep saying MOU because it's a memorandum of understanding.
Yeah,
so sorry,
they're very close. Memorandum of understanding or memorandum of agreement, yes.
So, and I just want to thank you for your patience and getting us to this part of the meeting, and for hanging around as we dealt with our technical difficulties at the beginning of the meeting, and also to thank you for the services that you provide to the citizens of Brockton. So thank you.
I thank you very much.
Thank you for having
Thank
us.
you.
All
Thank
right,
you.
thank you so much. So we will be in touch with you. So thank you. We will move on with the rest of the agenda. So thank you so much for attending.
Okay, bye-bye now.
Have a good night.
Bye now.
Bye.
Bye.
So the next item on the agenda is the COVID-19 vaccination. Looks like the city has been moving forward with some success, still some hesitancy in the population. So Dr. Montefiore, if you'd like to give us an update.
Yes, as you already know, Mr. Fitz, Dr. Brophy, on April 19, CDC, followed by DPH, have called for a pause on the J&J. And so on Saturday, which was April 10, the Board of Health vaccinated 765 people at the Shaw Center. Those vaccines were J&J. That was the 10th, and then on the 19th, they called for the pause. So at that point, we had about 75 doses of the J&J left. So we have continued to vaccinate with the Pfizer and the Moderna. So the numbers continue. On Sunday, which was the 11th of April, we did vaccinate 390 individuals. So that weekend was a very busy weekend, very successful weekend, because you had 765 plus 390. So we continue to do this. That was the highest success we had in one weekend. Ever since we've been doing clinics also at the Shaw Center, we have reached up to 348. And then we circle through the low rises and high rises with Tom Thibault, who is the housing authority, Brockton Housing Authority. And then we had some success. We have done 2 clinics at the Westgate Mall. We did one for WB Mason last week. So we continue to do it. And today we had the 3rd clinic at the Cape Verdean Association as well. So those are small numbers, but they continue to at least make the vaccines available to different populations who might otherwise not come forward for it. So basically, we take it to them. I must also mention that we had one church at 65 West Elm Street that the Board of Health went to do a clinic as well. So we continue to reach out and do different clinics. DPH is a very great partner. We develop a great partnership with them, and they have contracted with the Yankee Line, which is a mobile van company to do mobile clinics. So basically, we haven't contracted with them, subcontracted through them to do mobile clinic, but they have come to the Shaw Center to help us to vaccinate and to help register people to get the vaccine. So it's been a great partnership. So far we're continuing to do the best we can to find these individuals who want the vaccines. We also had a small one over 2 weeks ago at City Hall for the city employees. Unfortunately, it was a very low response. There were only 12 people 12 employees, among them Mayor Sullivan.
Do you have any idea of where we stand with vaccinations in this city? I know this is difficult because it's being done by multiple places, but
well, we've done. I mean, along the Shaw Center, Brockton neighborhood has done over 25,000. The Board of Health has done over 12,000. Overall, people who have been vaccinated in the city of Brockton, either through those two entities, Brockton Neighborhood Board of Health, or with the mass sites, Gillette Stadium or elsewhere, over 30,000, more than 40,000 have been vaccinated, because Brockton Neighborhood and the Board of Health has done over 35,000 between the two of us.
right.
It's like half of Brockton then.
Yeah, the only thing is that most of the vaccines, Pfizer and Moderna require 2 doses, so which means that those vaccines that we talk about, I would say more than a third have been used as second dose.
Right.
The J&J is 1 dose, but since April 19, it hasn't been used, even though CDC has reauthorized it, has lifted the pause, but people are a little bit hesitant to accept it. And now, within a month, within 2 months, the state sites for vaccination will be closed, and probably that will increase the demand on local Board of Health to provide the vaccine. So we open to that, and we're looking to see how we can be prepared to meet the demand.
Yeah, I'm sure you really only have the community health and what you've done, but as well the many people in doctors' offices, as well as those that went to the mass to the various large centers, Gillette, etc., where people also have gone to be vaccinated. So just if you had an idea, or if the state is anyway keeping track of this, that could give us numbers. But I can look on the state dashboard. How is the city doing right now with the current number of cases in the city?
We are still in the red. Today we are at 28, about 28 cases per 100,000, or 28 cases per day. And then the positive rate is like 4.8. So which means that both of those indicators in the dashboard, in the matrix, keep us in the red, because you have to be below 10 cases per day per 100,000, and also below 4% positive rate.
Yeah, so we are still in the red, but we've been coming down recently. Is that correct?
Yes, and furthermore, it seems that the numbers are decreasing. So probably within 2 weeks, it looks as though we may be in yellow, below close to 10 per 100,000 per day per 100,000 or somewhere around there.
Yeah, so I did just applaud your efforts and to just keep moving. And, I think, your community outreach, getting out to the community, using, all trusted members of various communities to help spread the word that, the vaccinations are safe. We're seeing is an incredibly low rate, and that COVID itself, I often hear, oh, well, we don't know the side effects of the vaccine, but we don't know the long-term side effects of COVID as well, and there's a lot of concern about, potential long-term effects of COVID in many patients, and we are seeing long-term side effects in some folks that have had COVID. So it's really important that people know that, and that they take the opportunity, when the opportunity is presented to them, to please go and get vaccinated for the sake of themselves and their family, as well as the community. But continue the great work and all the great partnerships that you've been working on to get as many folks in the city as possible vaccinated. So.
Thank you.
Doing a good job.
Thank you so
Doing a
much.
good job.
Thank you.
Yeah.
Thank you.
And I know it's been, you're not, you're operating with the staff, the level of staff for such a large city in this department. You guys have done, great work, and I'm sure these weekends and long days, because it is a long day when you're in a vaccination clinic, of work for everyone involved. And do let the members of the board the employees of the Board of Health know how much the board appreciates the effort that they have put in through this entire pandemic. It's been a stress on all members of the healthcare community, and to keep up the great work that they're doing. So
Yeah,
thank you so much.
Definitely.
thank you. In fact, if I may just add that today we have 2 clinics, one at the high school for students and their parents or guardians or family members who want the vaccine, and simultaneously we're having a clinic at the Cape Verdean Association for over 50 people. So we split the 2 nurses. One is at the high school and one is at the Brockton at the Cape Verdean with 2 volunteer nurses that we have hired. We have been whose help we've been using to help with vaccination, even with the seasonal flu vaccine. We have used them, and so they're with us today also. And then the school nurses are also helping at the high school. So we're very busy.
All right. So next is health promotion and public education. Any updates?
We continue to do education. We engage with the churches, and we have one church whose pastor is going to have a mobile clinic, or who is interested in having a mobile clinic at the church facility or in the parking lot. So sometime next week we'll conclude on that, and we have CTC or community contract community collaborative contact helping us to reach out to some of the businesses and encourage them to get their employees vaccinated. So that's how we got WB Mason to call us to get the clinic there. So we continue those endeavors, and we work with different other groups, the television and radio at the Cape Verdean community, as well as the Haitian community. So it continues, but we still have some pockets that have not been accessed to really do the education, but we continue to push forward.
Wonderful. Okay. So, any questions, Mr. Fisk? Or?
No, it sounds like he's doing the very best he can, and he's got a good crew there that, going out through the city, and they're doing the very best they can do.
And then the next item on the agenda is our position for a nurse. It sounds like we have a candidate there.
Yes, we opened it after we lost one nurse mid-March, but we only had 2 applicants. One of them is not a graduate. Nurse yet. She will graduate in June, and then she would have to wait to pass her board. So basically, we need someone who is ready to hit the road running.
Right.
So we reach out to the other one, and she's well qualified. She works. She's a registered nurse in the state of Massachusetts, and works for Signature Healthcare currently. So we extended the offer to her, and it seemed that so far things are working, and she may join us sometime either next week or shortly thereafter.
Great. That's great to hear. So I'm sure you
Sounds good.
have another pair of hands. Excellent. So.
Yes, thank you.
Okay, and then the next item on the agenda is that we have received money from the state to spend on COVID work, and so plans are for us to purchase a van for the department. On the plans, please.
Yes, correctly. We have some money that DPH has allocated before I came for FY21, which ends in June. I think there is a little extension that the federal government gives through December. So I don't know. I have to verify with finance and the state, because I think that deadline for that money, for that funds is extended to December, but I want to verify that. However, there is an additional 52,000 that they have extended to us a few months ago. So, which means that we have additional money for to use for COVID, strictly for COVID. And so we envision purchasing a van, which would do which would serve 3 particular purposes. One, it would help us to take our supply to the sites where we're having a clinic. Presently, when we move to a clinic, every staff member uses his or her vehicle to transport things, supplies. So the van would serve that purpose. Number 2, the van would also, we could equip it with a small fridge so that we could keep the vaccines refrigerated for the length of time that the clinic may be going on, instead of keeping the vaccines in a cooler.
Right.
Third, the van could also be used as for educational purposes, because we could have not only the name of the Board of Health on it, but we could have a message, animated message on it as it travels through the city or be stationed in one area. That message could be a way to also educate Brocktonians on the presence of Board of Health and what we do and how we try to reach out to them.
So do you need a motion from the board about purchase of the van, or is it, do you need any activity on our side to approve the money to be used for the van? And obviously the van, I mean, it's amazing that you've been able to have so many clinics in so many different places without having really the logistics of getting vaccine to the area, keeping it cold. It's a tremendous effort to try and do that. That's part of the reason I think many of the large centers were set up initially, because many local centers could not handle the logistics around the vaccinations. And certainly the van can be used in the future in other making vaccinations more available, whether it be the COVID vaccine or even vaccinations, flu vaccinations, et cetera, that the city does as this work in the future. So there's no issue with supplying the city rather than people using their own cars to carry around these supplies. We should have something appropriate for the medical equipment that and treatments that we need to bring around the city. But do you need a motion on our part to approve purchase of the van?
Yes, please. We would need your blessing. That would give us more leverage.
Right. So Mr. Prince, do you have any concerns?
No, I think that's, like I said, it's amazing they're doing what they're doing without something like that. And, just think what they can do now that they have that type of vehicle. I mean, they can only do more. So, I'd like to make a motion that we do, purchase the van and with our blessing.
So the motion's been made. I'll second. All in favor? Aye.
Aye. Aye.
And so the motion carries. Any other items to be brought before the board? Any miscellaneous items before we adjourn?
I just wanted to, I always bring it up about our homeless, under the railroad track. It just seems lately that it seems like there's not as many for a change. It seems like maybe 2, 3, 4, but it's not as many as it was. Is that anything that some of the health members and inspectors have been doing to help us out, or is it they're just not there as much anymore?
Do you mean?
The homeless people that you see, under the railroad, tracks, and it seems not quite as many as it was. I didn't know if people are finding or we're helping them out, finding places to live, or is it getting any better or worse? Or
Well, I know every Wednesday we have all head of departments meet with the mayor, and we address that. So, and also twice a week we have a meeting with the hospitals, including Father Bill. So the issue of homelessness is addressed, and the people sleeping under the bridge or on the streets. Father Bill tries to extend their efforts to reach them. The police department also try to help, but sometimes they go to place to try to remain under the bridge or expand their stay there, and it gets a little bit congested and not really pleasant. And so therefore, we try to work together with all those different agencies as a Board of Health to see how we can do it. But we personally, the Board of Health itself doesn't have the resources to actually invest in that. So that's why basically, more so it's an issue that is covered mainly by the Father Bill and other agencies, and then the police department that tries to assist in some capacity.
Okay. So it's being addressed anyway.
Yes, it has. Including the social services of the city through the mayor. Corinne Capuera was on the call earlier. So she's the director of the social program. So she's involved as well.
Any other items?
No, at my end, that's
All right. So with no other items, motion to adjourn?
Motion to adjourn.
okay.
All right.
Yeah.
All right. Well, thank you so
thank
much.
You. And the next meeting for the Board of Health will be June 3rd.